Hello, my name is Laura Reid and I'm a lecturer in Occupational Therapy at the University of East Anglia. I'm relatively new to this role, having recently moved from clinical practice where I was working in specialist amputee rehabilitation. Today I'm going to be discussing my role as a clinical case study lead for the virtual practice placements we recently completed with our second year BSc Occupational Therapy students. Across our academic team, there were 6 case study leads who all presented different anonymised cases based on an authentic patient, with the purpose of the students managing all 6 cases as a group and individually, and then selecting one case to present individually. The students were also provided with case-specific useful resources and evidence to direct their learning. For my case, this included links to recent guidelines, research, and condition-specific websites. Armed with their pre-reading materials, I then had a group of 6 students complete a virtual initial interview with me acting as the patient, for which the rest of the cohort were also in attendance for. This element of the project was enjoyable for the case study leads and the students, and it has been joked that we should have some Oscars coming our way. We changed our behaviour and responses during the initial interview in order to challenge the students and provide an experience which is as close to real life as we could get. This helped to develop their communication, their interpersonal skills, and start building on their professional reasoning, just as an initial interview with a patient would do in practice. After the initial interview, I provided feedback and guidance on the students' identified problems list and patient goals in order to support the students through the occupational therapy process and case management of the case study. The students were provided with resources to virtually visit another member of the multidisciplinary team, which for my case was a social worker. The final element of this process was to observe the students' presentations on their chosen case study. The presentations were similar to what students would have usually presented to me in practice as their educator at the end of their placement. It was a fantastic piece of shared learning as I got to see the case management from the innovative and passionate eyes of the students. Having recently come from clinical practice, I think the fact that students were dealing with multiple case studies across the 2 weeks was extremely beneficial for their learning. The majority of the students were on their 4th practice placement during this virtual placement, and it is essential by this stage of their training that they are confident with managing a variety of patients on their caseload. This experience gave them the opportunity to begin to prioritise their work and develop the use of occupational therapy process for each case, while still having the added bonus of additional time to research the associated conditions. The simulated experience has introduced them to the basics of caseload management, and they now have the opportunity to build upon this skill set during their next face-to-face placement, where the time pressures will be more advanced. I think that the use of virtual placements going forward, whether that be in lockdown or outside of it, would be highly beneficial for the students. It gives them the opportunity to develop their caseload management, note writing and professional reasoning, alongside receiving additional support and teaching from the university, which is something I feel they often do not fully immerse themselves in outside of practice placement. Thank you for listening.